And when you start to talk about artificial intelligence, you're calling on an analogy to more of what humans can do that for a long time machines couldn't match.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. We're glad to have Dr. Phillip Alvelda, the CEO of Brainworks. Dr. Alvelda is a technology and industry innovator as well as an educator. We'll hear more about his early work at DARPA and NASA Jet Propulsion Lab. He holds degrees in physics, computer science, and electrical engineering from MIT. The list of innovative companies and technologies is long, with over 30 patents on a wide range of technologies. So welcome to the Business of Healthcare podcast, Phillip.
Bob, it's a pleasure to be here. Thanks for welcoming me.
Okay, well, let's start with your new company, Brainworks. And I got to tell you, I love the name. So you've had a lot of things in the past, but kind of build us up to what Brainworks is and how you got there.
Yeah, Brainworks has been a little bit of a labor of love, I have to confess. Started for me back at NASA when I first got interested in AI techniques. We were building sensors for spacecraft and found that at that time, it's hard to imagine those computers had about the processing power of a Fitbit. Couldn't really do the things we wanted to do. And it wasn't until we began looking into more brain-like architectures for doing really tough computing and sensing tasks that AI started to look like a viable proposition that could really change things. Fast forward 30 years, I went back to grad school for AI at MIT and began starting companies. And now Brainworks is kind of like the stars and the planets aligning for me, where all the work that I'd done in neuroscience, all the work that I'd done in computing and VLSI and physics and materials all kind of came together to enable whole new technologies that could, for the first time, I think, really automate complicated things, not solve tiny little narrow problems, but solve really big challenges that used to require, lots of expertise, lots of people, lots of administrative overhead. And we couldn't imagine a better place to apply it than healthcare and trying to advance what we can do with these new tools and systems.
So AI, we hear that a lot, the artificial intelligence, and a lot of people say, well, let's kind of scale that back a little bit. Let's really focus on machine learning. So for our audience, why don't you give us the broader vision of AI, how you guys might be incorporating it, but really how that ties in and how machine learning is a subset of that that's more narrowly focused?
Yeah, I think it's important in this field, as we think about building automated tools, to be really careful about these kinds of definitions. And I think the use of artificial intelligence as a term versus machine learning, I think it captures a really important distinction. And there's a difference I see in a small, confined, narrow tool to solve a specific problem, and what we as humans think of as broader, more general intelligence that can solve multi-dimensional, multi-domain problems that might have some technical challenges, some sensory challenges, maybe even some economics or morals filtered in, things that humans kind of take for granted as a natural gift. But our machines, we haven't built the machines yet that could wrangle all of that complexity at once. So I think the big distinction for me between, machine learning is to think of a tool that solves a narrow problem that we can manage easily with a single, simple system. And when you start to talk about artificial intelligence, you're calling on an analogy to more of what humans can do that for a long time machines couldn't match. But today, I'm happy to say that we're starting to make real progress on how can you knit together smaller, more limited machine learning tools into ever more capable synthetic brains. And when I say a synthetic brain, I mean, we're building more of the pieces that we take for granted as fully arming our brain to be able to see and hear and remember and anticipate, and to build those capabilities into artificial systems. And so do more and more with machines that used to need people to do.
Well, I know we're going to get more into the details of the problems that you're trying to solve with Brainworks, and that term synthetic brains comes up. And another term that I hear when I hear about Brainworks is it's a foundry. So kind of give us your insights on why Brainworks is a foundry.
Well, the idea of a foundry has been around since we were smelting metals and building the first simple machines with mined ore. The idea of, casting something out of nothing, designing it, building it from the ground up. And when we think of Brainworks as a foundry, what we're creating are artificial brains, artificial synthetic brains that can solve complex cognitive problems. And we like the idea of calling it a foundry because this isn't a synthetic, it's not a theoretical exercise. We're building actual machines in the sense that we want to automate something important. So that's why we like the call to the history of, the roots of engineering, where we take these new theories and understandings of how real human brains work, and then we use those distilled principles of technology to craft and assemble something that really works and churns out useful work.
Now, my understanding is you had many different walls you could lean your ladder on, lots of places you could climb, and you decided to really look into the area of delivery of healthcare services. So how have you applied this synthetic brains and this AI machine learning technology into the area of healthcare services?
Well, it was actually a really interesting exercise. We took a little over a year to go through a range of different technology targets where we could make these more capable thinking machines that would solve more complicated problems and imagine, how would we build something that would have big impact? And, we looked at education, transportation, energy, physical security, fintech, fraud detection, cybersecurity, just really dozens of different areas. Built financial models, looked at societal impact. And every time we turned around, the need, the burgeoning overhead, the rising costs, the benefit to people, healthcare dwarfed every other opportunity in its immediate need and chance for real contribution. So that's where we decided to focus. And as with many AI companies, one of the mantras that you often hear is that the data is our oil. We need our fuel. We need data to be able to understand and build models and build an automated system that solves problems. And so our initial approach was to say, all right, let's see what data you have. We partnered with a couple of really forward-looking healthcare groups, got a giant trove of data. It's pretty clear that the biggest opportunities are in heart health because, of course, that's the number one killer in the United States and globally, really. It's also the number one expense with the number one overhead. And so, it was natural to focus on that part of the market as an initial entry point. And so we partnered with the hospital. We looked at the data that they offered us, and they dumped a huge trove of data on us. But one thing became immediately clear was that they have a tremendous amount of data after someone has a heart attack or after they have a stroke. But before, there's nothing. So all of the cost and the expense and the overhead in heart health primarily is that all we're doing for the most part is reacting to crisis. And we realized that there was a fundamental challenge underneath it all, that in order to have your vital signs assessed at a clinical grade quality, you had to go into a clinic and have it measured. But that's a lot of friction, it's a lot of overhead, and when you start to amortize all the costs of the nurses and the doctors and the facilities and the equipment and the time that it takes, it's on the order of $300 of expense, fully amortized, to go in and have your vital signs measured and assessed by a physician once. And so it's not a surprise that given that expense and overhead, that it's so hard to get data before you have a crisis and understand finally that maybe you should have been looking for a little while. And so we realized that the really golden opportunity that everyone had kind of overlooked was how can we automate and enhance and dramatically change the cost structure of assessing your vital signs at a clinical grade of accuracy. And so we realized that the AI techniques we had could make some really unique contributions in this area. And we focused them to enhance, what could we do with a new generation of sensors with AI enhancement that could see more, sense more, collect more accurate data? And can we, in fact, automate that in such a way that we can have these sensors in front of you all the time, long before any crisis arises, so that we can continually assess your state of health and predict when you might have a crisis or when you might need to change some lifestyle habits or, imagine a new medical treatment. And so that's what we did. We applied the new AI techniques to enhance a new generation of video sensor analytics, so think cameras, and be able to assess vital signs just using computer vision without even touching you, to replace all of the cuffs and leads and nurses and all those things. And the real opportunity wasn't just to make a camera that you could shine on someone and say, all right, as long as you're in front of the camera, we can be detecting your vital signs. We ended up building a much more complicated synthetic brain that automates all the functions of the nurse, that looks at you, figures out who you are, figures out what's in the camera field of view, figures out what vital signs can you assess from whatever you're sensing from that one camera. If you're a consenting patient, it can log your data to your health record. If you're not, we comply with all of the HIPAA and privacy law type compliance issues and discard all the data, and nothing is stored. But what this means is now the marginal cost of sensing vital signs goes through the floor. And we can have the system operating on any camera, any laptop, phone, webcam, smart TV that can in fact be looking after your health constantly.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
So, Phillip, what you've described here with this capability to really become more efficient, finding a new way to look at vital signs. I mean, for 50 years, we've been using the same technology, blood pressure cuff, looking at things like this. Without a visual on this podcast, how do you go about getting this data? You're talking about using modern technology. I see the term ambient biometrics. Can you kind of expound on that and try to paint a picture for our audience how you go about gathering these new vital signs more efficiently?
Yeah, so the challenge, is one of sensing and analysis and data collection and recording end to end. And what we designed was a system that works very much like Google does when you make a web search. You type in the search term, it uploads the search term, Google breaks it out to thousands of servers that all in concert work on searching one part of the World Wide Web, and then they aggregate all the search results and then they send it back to your browser. And it's like having this giant supercomputer in the sky that, when you ask a question, it immediately goes to work, and so many of them go to work so fast that they give you a massive amount of computer power in a fraction of a second, and it seems like magic. So we're doing exactly the same thing for health analytics. So we can send a 5-second segment of video from any camera to our supercomputer in the sky, and then it dispatches it to a whole host of computers, each one of which is looking at one aspect of the image. One might be looking at your heart rate, another at your respiration, a third at your blood pressure. And every quarter, we're building new software to look at more and more biomarkers, first in physical health, then moving into mental health, and then automatically figuring out who you are and recording it to the appropriate medical record. And so what we have now is a system where anytime you're under the view of a web-connected camera, we can be looking after your health. And so that has a huge range of applications across healthcare. As you may know, before you do any sort of medical diagnostic process or procedure, the FDA requires that you assess a patient's vital signs. So everything from neonatal care, where you've got infants and little babies, which are super squirmy and have very sensitive skin, we can now sense their vital signs without touching them or without worrying that the leads will pop off when they wriggle around and kick. So all the way up through, managing beds in hospitals where, they used to have the push carts to measure your vital signs every 2 hours, and they would wake you up to put the cuff on and so on. Now we could do it without disturbing you, and we could measure constantly instead of having the cart and the interruptions.
So with a video camera, I can be in front of a video camera, and you can detect my heart rate. You can detect my breathing rate. Can you detect my blood pressure? What else? What all can you do? And that's all accurate. That's all very accurate and supported by the FDA.
Yeah, it's a journey in progress for us. We've got the heart rate and the respiration components already in field validation trials with a number of hospitals, and the blood pressure group is gearing up, and we have the first prototypes operating and under test. And we have a pretty extensive roadmap of everything from detecting things like motion disorders, detecting and anticipating seizures, sensing level of jaundice and energy expenditure to evaluate the need for dialysis and the efficacy of treatment. There are applications for detecting behavioral drug efficacy. So a wide range of biomarkers of both physical and mental health. That over time, we expect to add more and more and more. And, the beauty of a system like that is, the marginal cost is really just the cost of development for us, but it's the same sensor feed that does the detection. So we expect to be able to do more and more and more sensing and analytics for less and less expense. And we see this an opportunity to really, for the first time, make meaningful progress on the industry holy grail of shifting away from reactive care to preventive care.
I can see that has a huge market potential. This reminds me a little bit of Kai-Fu Lee in China, who in China, as you know, they have video cameras everywhere, and they're constantly gathering data. And I remember seeing a 60 Minutes presentation with Scott Pelley, and Kai-Fu Lee's cameras watched him walking down the street, and they basically got his height and weight and his age. And they said that he was like 62 years old. And Scott said, well, I won't be 62 for another 3 days yet. So how do they do that? They're sampling millions and millions and millions and millions of faces. And Kai-Fu Lee kind of took this. I know you have an education background as well, Phillip, but he took this to the remote cities where the left behinds are. Those are the kids that are left behind as the parents go to the larger cities to work. And they were using this video capture technology to find out which kids were falling behind in studies, which ones were advanced, which ones were understanding the lessons, which ones were dozing off. And just remarkable amount of, artificial intelligence, very focused machine learning. And you're really applying all of this into the whole medical area. It sounds like from birth to death, all the way from the babies being born up through elder care. That's a big spectrum of coverage.
It really is. And I think that it's important to understand that, many of these technologies, you hear, every other podcast describing, apocalyptic misuse of these sorts of things. And it's important to understand it does have two edges. The same kind of technologies that are at the root of what we're building to look out for your healthcare and predict health problems as they're developing before you have a crisis could be misused for oppression to tell, when people are having subversive feelings or tracking their every motion or response to propaganda. So those technologies, as we see with weapons and other technologies, they can be used to defend or attack, your rights. And so we see it as critically important in how we exercise stewardship of what we design and build and have control over access to these technologies and make sure that the people who participate are responsible, civic-minded people trying to bring about public benefit and not oppression.
Yeah, that brings up a big ethical concern, which I know that you already mentioned, consenting patients, that this could be used in a variety of areas. But if you're going to use it in the medical area, you want to have ethical governance on it and have consenting patients that want to be taken advantage of this technology. Today, we have this coronavirus that is in the news, and it's spreading pretty quick. and there are superbugs that are out there. MRSA is one. Can any of this technology be used to help either educate or control or get the touch element of interaction removed? Is there a play for that in the whole idea of these superbugs?
I think for general hospital operations and healthcare operations, I think there's two, kind of important features. One is, just within a clinic, the ability to assess vital signs without contact is actually important. One of the poorly kept secrets of a lot of these urgent care clinics and hospitals is that one of the biggest transmission vectors of disease these days is people coming into the clinic and catching something while they're there. Most often it's from something that was either difficult or awkward or impossible to sterilize. And one of the chief candidates, it turns out, is the blood pressure cuff, because it's made of materials that you can't put in an autoclave. And it's hard to swap things down. And of course, with the drug resistant superbug growth, more and more diseases don't even blink when confronted with a swab or alcohol or some other things that it can withstand. So I think that there's an important role, initially just by having the non-contact feature to reduce that vector. But I think there's a secondary effect, which is also important, that a lot of these technologies now we can begin to evaluate the vital signs at a clinical grade of accuracy without requiring you to come into the clinic. And so being able to stay in your home and avoid the other people that are sick and transmissive, I think, is one of the biggest potential contributors of reducing that sort of challenge. Now, beyond that, there's certainly ways we could build the vital sign detection systems into more public infrastructure. They've already got cameras over the TSA, security areas. They've already got cameras in most of the airports and hotels. And so I think there's ways to, put these security systems to better use than simply watching over you and making sure you're going where you should go and not going where you shouldn't. I think these sorts of things could also integrate carefully with the healthcare system. But I think you identified the key issue is how do you manage the privacy and who should have access to and be able to contribute to your personal information. So a bunch of thorny issues to wrestle with, but I think certainly contributions to be made.
Well, I see this as a value add into what we now call, virtual health. Some people call it telehealth, but it's not uncommon for someone to get onto their iPhone or iPad or smartphone and connect with their doctor, and the doctor can hear them breathe. The doctor can, look down their throat or look at a bruised ankle. But this gives even more information that could be integrated into that environment, really providing more diagnostics and more insights than ever imagined before. So where are we going? Where are we going with Brainworks? What's the next step? I know you're a startup company. How long have you been in business, and where do you see your future?
Well, we incorporated the company a little over a year ago, and so we're a relatively young company at the moment. We're in collaboration with 3 different hospital groups and trying to grow that network as rapidly as possible. So, for anyone that's in the industry that would like to see some of these forward-looking technologies have real impact on patients and doctors and hospitals and clinic operations, we're looking for those partners that are intent on kind of reinventing and improving how we do these things. So, we'd welcome any interest that arises, any potential collaborators in our mission.
Well, I'm sure our audience is very interested in this, as we are. We're going to continue to follow you and stay in touch. It's been a great honor to have you, Dr. Phillip Alvelda, CEO of Brainworks, on our Business of Healthcare podcast today. So thank you for your time and your interest.
Bob, really appreciate it. Great questions, and hope your audience enjoyed our discussion.
I'm sure they will. Thank you.
Take care.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.